Hello again. This is part two of the experiences that an individual would have in a psychiatric hospital. Again, I remind you that I myself have worked in psychiatric hospitals and had 20 years of experience with this. I want to speak now about what happens once you come to the unit from the crisis center. Well, probably by the time you arrive, you'll be pretty annoyed because you've been waiting in the crisis center for what feels like forever, and you may be a little agitated about that, and you're probably going to be pretty glad that that process is over, although you probably will be very annoyed that you now are in a psychiatric hospital, whether by voluntarily admitting yourself or by having to be involuntarily committed. And let me say something about that for one moment. Even if you're involuntarily committed by an emergency room because of a suicide attempt, you will be given the right to revert that to a voluntarily committing yourself. You will be able to sign off on some forms, and then you will no longer be involuntarily committed. However, if you want to fight the involuntary commitment, they will take you to mental health court. And there have been people who have presented themselves very well in mental health court and have been discharged the day of the court because they're ready to go. But let me speak on what happens once you get to the unit. Basically, the nurse will take your vital signs. In some hospitals, they will do a search of your body, not a cavity search, just a search to see if you have tattoos or any wounds or any bruises, anything like that. Probably they're doing it most likely also to cover themselves because they don't want you to have to say they did something to hurt you in any way, therefore they have it documented. The process after that, basically, a lot of people come in, it's like overnight, and they let you go to sleep, or, if it's during the day, you just pretty much can get acclimated to the environment. If it's at night, the resident on call or the psychiatrist who saw you in the crisis center will probably write something for you to help you sleep. That's pretty much a common thing that's done. Some people don't need it and they don't have to use it, but something will be put on order for you. Basically, during the day, you'll be attending groups. When you first get there, you may be on suicide precaution, SPs as it's called, so you may still not have your belt. They may take away any strings out of your sweatpants, so they'll take your sweatpants away because it has strings. They'll take your shoelaces, anything they think you can harm yourself with. You will never have use of a razor in your room. You will be allowed to use it and return it, but you will never be able to keep the razor. Those types of things are watched. And it's, again, for your safety. I can't mention that word enough. Basically, what will happen is, and again, I'm watching these megabytes, once you're on the unit, you will, have breakfast, lunch, and dinner at various times. Some units, you can go off the unit to have breakfast, lunch, or dinner. Some places have great food. Some places, forget it. You probably lose a few pounds. They have groups during the day for you, discussion groups, arts and craft type groups, more or less experiential hands-on type things, or things where you just sit in a group discussion. Some units are male and female. Some units you can go to, there'll be a woman's unit, or it'll be a dual diagnosis unit where you have a mental health disorder and a drug addiction problem. So there are different types of units that you would be most appropriate for as well, and so those groups would be geared to those types of things. Then, when the treatment day is over, you'll see a psychiatrist each day at some facilities. They call that doing rounds. Sometimes only 10 or 15 minutes, but it's enough to gear where your moods are, because all day there will be psych techs watching you. You will be watched every 15 minutes on suicide precautions, and you will be watched every hour when you come off precautions, and they keep a flow sheet. They just keep a sheet every hour where you are, and they have to do that to protect you. So, if you don't try to hurt yourself, or, they just have to know where you are. And that's being done by the techs. So basically the techs are glorified babysitters, but some of them are really good. They've worked at the facility a while. They're like counselors. They know how to talk to you when you're feeling agitated. They know how to talk to you when you're feeling depressed. They're probably your first line to getting to the staff. So even the cleaning lady will be able to sometimes talk to you. There'll be a cleaning lady sometimes that'll go by, or a cleaning man, and they'll talk to you for 5 minutes, because a lot of people who do work at psychiatric hospitals do love their jobs. I found that in the medical world, you either have doctors who love that field or they hate that field, one or the other. And it's like a lot of times there's no in between. So a lot of times people who are working in psychiatric facilities, they're there because they have a mental health disorder, or they have a drug addiction they're recovering from, or somebody in their family is involved in some way. So for a lot of people, believe it or not, it is a labor of love. They don't get paid very much. Let me tell you, I don't think a psych tech makes more than $10 or $12 an hour, if that. So they're not in it because they're getting rich. A lot of them are in it because they're giving back their heart to something that's helped them. So you have to understand from that that they're not out to hurt you. They're not trying to hurt you. If you get violent with somebody, yes, then they will have to do certain things to keep you from hurting yourself or others. And what I'm going to do, I think, is in the very next video that I do, I'll talk about that. I'll talk about restraints and seclusion and things of that nature. But at this point, I just, want to let you know that when the treatment day is over, a lot of times there's a TV, there's a lounge area. You can sit there, you can watch TV, you kind of vote on what you want to watch, or somebody just puts something on and you watch it. Half the time it's so noisy, people are talking, you really can't hear it anyway. They have magazines, they have books, they have board games, they have card games, they have arts and crafts you can do. They keep you pretty busy. And they know you're bored, they keep you busy, and it's a good time to spend talking to the other patients as well. So I'm going to stop here and go on to the third video. Thank you.